Listen-only mode.
In this tutorial, we will cover patient billing preferences. To access preferences, go to Navigate, open your administration folder, and select Preferences. The top section allows you to select if you want your preferences set up by your whole organization, by individual practices within your organization, or individual locations within each practice. I will set my preferences up based on my organization, and they will apply to all practices and locations. Under Preference Group, I will select Patient Billing Control. The first section of Patient Billing Control is in regards to cycling. Use automatic cycling yes turns on this feature. What that means is based on your cycle dates, which is seen here as 28, if a patient is getting a patient statement and cycling is turned on, no matter how often you do patient billing, daily or weekly, this patient will only get a statement every 28 days. If cycling is turned off, then each time you do patient statements, every patient that has a balance on their account will get a statement. Minimum balance is set so when patient statements print, as seen here $5, that a statement will only print if a patient owes $5 or more. If a patient's balance is less than $5, a statement will not print until he reaches that minimum. Billing fee allows you to set up an automatic billing fee to be applied to a patient statement based on the age of the statement, which is set up under a grace period. You can also set an interest rate to apply based on grace period with a minimum interest amount. Sort by allows you to change if your statements print in patient last name order or by zip code. And Sort within practice allows you to set up statements to divide by practice when they print. On a patient statement, there is a left header, a right header, and then a section for a special message. To set the information you want to see on the patient statement in this header section, you click on the header and enter in the information. Once you have made alterations to this section, you want to make sure to save. The next preference you can set up is under Patient Statement Format. In this section, you can determine if you want dunning notices to print at the bottom of the statement, which dunning group you want to print. Here you see System selected, which are the dunning notices that come with Perfect Care. And then if you want to retain current dunning notice. This means if a patient has gotten 3 bills and you're on your 3rd dunning notice and they make a payment on their account, do you want the dunning notice that is currently printing to retain, that their bill is 90 days past due, or do you want it to go back to the first dunning notice, which then retain current dunning notice would be set to no. Under formatting options, it gives you the opportunity to change the format of your statement and what information you want to print on the statement. Here is where you can enter if you want a credit to print on the statement, any charge notes that are entered in the charge screen, payment notes that are entered in the payment screen, referring doctor, etc. Again, make sure you save once you have made changes to your preferences. Formatting options can be also changed based on patient in the patient registration screen. By clicking Navigate, opening my Perfect Care EHR folder and going to Patient Registration, once I bring up a patient account, under Additional Information Patient Statement, you can make changes that are for a specific or this specific patient only. To set up dunning notices or to make changes, dunning notice access is in your Patient Billing tab. So click Navigate. In your Perfect Care EHR folder, you will have a Patient Billing option. When you open your Patient Billing tab, you will have a Patient Billing menu at the top of the screen. Select Dunning Notice. This will show you what your current system dunning notices are. You can edit them by clicking Edit and then clicking in the box that you would like to edit. If you'd like to set up your own system dunning notices, click New, give your dunning notices a group code or name and a description, and then add your message for each dunning code. The dunning notice that prints on the patient's statement can be altered in the Charge screen. So if you go to Navigate, Charge, open a patient's account, and then go to Review Charges, click on the charge and edit, you will see Dunning Notice in the bottom right-hand corner. Currently, this charge, if when billing to patient, will have the first dunning notice. If the patient has received 3 statements, you will see it set to 3, but you can change it back to the first one here in the Charge Edit screen. This concludes the tutorial on patient billing preferences. If you have any questions, please email support@questions@ncgmedical.com or call the support helpline at 1-800-330-1906. Thanks for watching.